I welcome any questions. You could put them in the chat or feel free to unmute yourself, and I can answer those as we go.
Really quickly, I'm sorry to jump in. I wanted to introduce you again because we just started the recording. And so this is, I'm so sorry, just go with it. This is Brandon Patterson, and he's gonna talk to us about healthcare research. This applies to all the institutions in Utah. He's not teaching us anything that is unique, and that is only possible to cook up here in the University of Utah. So anywho, we're gonna drop the bio into the information about the meeting. And I'm so sorry, Brandon. Go ahead.
Oh, you're fine. Okay, great. So let's move on here. So today, what we're gonna learn is we're gonna find your research impact. So ways that you might be able to look, even if you've published before, you might be interested in seeing what your research impact could be or has been, and then we're going to look at some research searching basics. So I'll go over some different tools and resources. So feel free to write those down, or this recording is available. You can always go back to it. I'll briefly discuss kind of how to use them, and then know that the library here at the University of Utah, where we specialize in health sciences, databases and information, and we can help any student throughout the state, even if you're not coming to Utah, with your health sciences information and research needs. So we are also part of the national network for the Library of Medicine, which is a national program, as well as the National Training Office for the Library of Medicine. And so we serve a wide variety of folks around the country. So, all right, so maybe first we want to discuss why research impact is important and why you might be considering different areas to eventually publish in and share your research with your colleagues. So one of the things to note here is that 80% of citations come from about 20% of journals cited. So those top tier journals that we hear about often, Nature, Science, any of those journals are going to be highly cited and highly read. So that's something to consider, is we're getting our information a lot from these highly cited areas. So that might be a factor to consider. And knowing that this research impact affects people you work with, so knowing that, based on which institution or which hospital you plan on joining, there's going to be different expertise, and that's going to affect the people you work with. It affects what we do in the library in terms of what journals we subscribe to. You might understand that we're trying to subscribe to those journals that are being read the most, and so that affects us here at the library. It affects funding, so how you're able to get funding for the research you're doing. If you're able to do studies that are cited more, then you're going to get more eyes on you, which could give you more funding. Considering tenure, if you're interested in a faculty position within the medical or health sciences fields, certainly that's something to consider. Also, starting to establish your expertise in a field. I talked about this earlier with some of the people you'll surround yourself with, but knowing that that is something that is also tied to your impact. And then finding others in your field or subject area. So you might already have some mentors which have guided you into some areas of research that you might be interested in initially, and then knowing that you can break off from that mentorship and maybe find other mentors throughout the country or even internationally that are doing work in an area you're interested in. And there are ways where we can search through the citations of different articles to find what researchers are in our areas. So I can go over that today as well. So a few other things to to look at in order to decide on where to disseminate your research is who's your audience. So are you tending to maybe reach a lay audience? So maybe you're wanting to publish your work in a journal that is open and free for anyone to view, or you might be maybe instead you're looking to write op-ed for a newspaper, or looking to write something for your organization where it can get around to your colleagues. Where do you tend to get your information or your research? Are there certain journals that you tend to look at more frequently than others? Maybe that's where you disseminate your research. Where do your peers or your mentors submit manuscripts? Maybe that's often a way in which you can learn from your peers or your mentor and get some advice from them, especially when you're submitting that first manuscript. Are you interested in international readership? Is the journal peer-reviewed? That's a very important process when you're trying to establish credibility from a journal, is that it is peer-reviewed. You're getting your peers to look over an article and say whether or not it adds to the scientific field. And so that's certainly something to consider. And then do you have a preference, or maybe a funder has a mandate to publish in an open access journal? I mentioned this earlier, but open access tends to be free journals. They usually, depending on their funding source, might even have the authors pay in order to get published into these journals. So certainly tread lightly in that area, because there are publishers that take advantage of this system. They're called predatory journals. So if you are interested in publishing open access but have questions about the legitimacy of that journal, please reach out to us at the library, and we can give you guidance there. All right, so what are some of these measures in which we're looking at impact of research? So there's these traditional measures, and then there's these new alternative measures in which we're looking at research impact. You might notice some of these and know what they are, but we're going to kind of go over these traditional measures, which include Web of Science, Google Scholar, or Scopus, and then some new alternative measures as well. Okay, so this is a report that anybody can look at. It actually looks at the citations of several journals. And so you can see here that these journals are ranked based on their journal impact factor. You can see here on the right-hand side, we have a 7.6 by the Exercise Immunology Review, Sports Medicine's high up British Journal of Sports Medicine. And this is specifically in the sports medicine field. I have to say that I took this as an example area. And so, yeah, you can see how impact factors in this field in sports science 7.6 are much different than those fields in, let's say, this is like cancer research. So now you're doing an impact factor of 187 for the Cancer Journal for Clinicians. The New England Journal of Medicine also has a very high impact factor. So depending on your area where you're going to do your health sciences research, that's going to kind of lead you into whatever journals you might do, and that changes the impact factors that you might consider. So how do we get to this impact factor, this journal impact factor? It's really the frequency which an average article in a journal has been cited in a particular year. So you can imagine that journal, like the New England Journal, had 72. So that's looking at the frequency in which an average article is usually shared And we can look at ways that is calculated, which I have in the next slide here. So it's looking at the number of citations a year by the total number of articles published in the 2 previous years. So you can imagine that New England journal has a lot of publications that they put out, but each article within that journal, within a 2-year period of time, is cited at least 72 times. So you can imagine that is a high number. And here you can see they're also looking at ways in which that's increasing or decreasing over time. And that might be also something to consider, is usually journals do tend to have that high impact factor over time, but there might be something happening, like maybe there was an article that maybe published something that the author maybe took from someone else, and so that might drop their impact factor if they're seen in that chart. So let's go into an example. So this is Sarah Ferguson. She's in Communication Sciences and Disorders here at the University of Utah. And let's say I'm interested in seeing what her impact was in her field. And this is something you might be able to look at for either mentors, or if you yourself have published before, this is something you can begin to do. So you can see what's called an H-index on Google Scholar, for instance. And this is something where you can type in your name, and you can start to see some of the papers you or a colleague have published. You can see what that means in terms of your H-index, which an H-index is, you have basically, if you have a H-index of 4, you have 4 papers cited at least 4 times. It looks at, so the more you have published, hopefully you're getting more citations, so you'll get a bigger index score. All right, and yeah, so you can see, I think this is Dr. Ferguson's information now. So you can see that we've looked up on Google Scholar, and this is, I believe, Scopus. So now I can see, based on Scopus, Dr. Ferguson has an H-index of 10. You can see over time, since 1999, there's been 24 different publications. Total cite is 365. And then we can see that same information here on Web of Science, where now you can see, it's interesting, it's the same person, Dr. Ferguson, but now an H-index of 8. So knowing that these are different tools, so they come with different H-indexes, but when you are putting up your scholarly portfolio, when you're going into that research, eventually you can kind of average those and get an H-index that you can talk to. All right, and you might be someone with a fairly common name, or you can see this Tom Green. There's several Tom Greens, or even if you don't have a name that tends to be popular, but you want to make sure that people can find your articles and aren't being confused with either another person with your name, or there could be maybe you choose to like change your last name if you are married or something. That's where something called ORCID is really nice. It's called ORCID ID. This is something that's free and available to anyone to register and do. It takes literally 30 seconds. It's really easy. You put in your name, your identifier information, and then you're given an ID that you can attach to any article. So you can look up yourself or colleagues based on their ID. You can see this is one of our surgeons here at Utah. You can see where else they've worked. This is something that when you start an ORCID ID, you can start to fill in. And then you can see now it's attached to those articles, and you can calculate your H index now based on that ORCID ID. So I have the right Tom Green now from the University of Utah, and you can see their H index is at 81. You can see it's really easy to link this on articles. This is just an example of somebody submitting for an article. It usually just has a field to put in that ORCID ID. It is a standardized way in which people are identifying themselves when they're publishing. So I would really recommend creating one if you haven't already. You can also, again, look up by ORCID ID. This is PubMed, which is a useful database that we'll talk more about. And a lot of time that's a little easier than putting in maybe a last name with first initial, middle initial, author. It's a little easier to search by ORCID rather than author. All right, so that was kind of the quick and dirty of kind of the research impact and what to consider as we're looking into publishing and our research, where we want to disseminate that. So now we're going to do some search basics, and then I'm going to go back to just a few more things about impact before I end today, and then we should have time for questions as well. All right, so the first thing I want to start out with is this term called PICO or PICOT. Some of you might have heard about this in your classes. This is a really nice way where we can start to consider what it is we want to ask in terms of our clinical question or our research question, and turning what we want to ask into something that we can then search. And so this is kind of your first, I would say your first place to think through before going into any search database. And so what does this stand for? So the P stands for patient or population or a problem. The I is the intervention. The C is the comparison or control. The O is the outcome. And then T, which is sometimes used, sometimes not, is kind of the time. Is it over a year you're doing this? Is it over the clinical stay of someone? And then why do we use it? Again, it's to make more answerable questions that we can then generate search terms for. You can see, we'll talk more about kind of the answers to the universe, but no, this is something that kind of can be a representation of that. Okay, so let's do just a case and think through some search terms using the PICO format. So let's say you're a school nurse at a school in a low-income area. One aspect of your job is counseling pregnant teens with the aims of enabling them to complete high school. You've even been conducting home visits on top of your normal in-school meetings as part of their preparation for motherhood counseling. You want sources to back up the effectiveness of these home visits. Okay, so this is quite a case, and I'm interested in finding some research on this to look into the databases. So let's use that PICO format. So first, what is the patient population we're looking for? Yeah, if you said pregnant teens in low-income areas, you're exactly right. I, what's the intervention we're looking at? Yeah, home visits. So we're looking at home visits on top of normal in-school meetings, okay? What is the comparison? The normal in-school meetings only, okay? And then what's the outcome we're looking at? we're seeing which of these students, pregnant teens, will complete high school. All right, so this time we're not going to consider T as a time. Oh no, I guess this one we are. So time, sometimes it's built in, like this one, home visits versus normal in-school meetings. So we don't have to consider that one as much. All right, so we have kind of our ways in which we want to search the literature. We have some good key words we could use. We can also come up with a very succinct research question now. So using the PICO format, we can say now in low-income pregnant adolescents, do nurse home visits adjunct to in-school interventions compared to in-school interventions alone increase high school graduation rate? So now we have a research question we're ready with, and we have some terms. So before I usually go into a search database, I like to just give some general tips. So know that you're not going to find maybe every piece of that PICO question, and that's okay. Maybe we're just starting with pregnant teens and graduating high school, for instance, and seeing what that gets us initially before we add in some of those other things. It's also important to look at synonyms for these PICO components. For instance, pregnant teens, pregnant adolescents. We're thinking of different ways that the literature is going to be talking about this topic, and trying to capture as many of those as we can. We might consider opposite. So what are other words in terms of like graduating students? We could consider dropouts, for instance. So we kind of capture the negative or the opposite of a graduate. We can also combine terms. We can do some exploratory searches, see what comes. You really can't break anything with this. So it's nice just to put down some searches and see what you get. And then think of terms that others might use in a title abstract. I kind of mentioned this before. And then keep track of what you've brainstormed and write it down and don't delete it, because it's nice to know what you've done. So when you come back to it, you don't do the same thing over without learning from some of those searches. All right, so let's say I put together this one based on those PICO concepts. So we've found some synonyms to pregnant high school adolescents, like teenagers, adolescents, pregnant, high school mother, parent. You might be asking, what are these little stars next to these words? In most databases, what this does is by putting an asterisk or a star after several letters, it'll come up with different endings to that letter. So for teens, maybe I'm considering teenager or teenagers, teens. It could even capture like preteens. So this is thinking of like pluralizing it. Adolescent is another example. It's adolescents or adolescents. Pregnant, pregnancy. So you can start to think of other endings so that that literature is being captured in that regard as well. This is where when I'm in the database, I'm considering the or, and, or not, which are kind of the Boolean operators that are used in databases. And again, this is a little more advanced in terms of your searching. Again, you can't break anything, so it's nice just to try it and see what you get. So oftentimes when I'm looking at areas like this, since these are all synonyms, I'm going to use or as a mean to capture all these words in a database. So I'm looking at teenagers or adolescents or pregnancy or high school or mother or parent, and any of those words can be captured. And then I'm using that same thing in this area and in this area. And then I'm combining these all together in one search strategy with and. So I'm interested in teenagers or adolescents or pregnancies or high school or mother or parent. That's one bucket. And school nurses or home visits or house calls and in-school meetings and So you can kind of see what I'm getting at now. And this would be what you get. So you get teen or adolescents, so you can see where the ands fall in. Okay, so before we go into those tools, I do want to just take this over to something like PubMed. So PubMed is a free and available database for anyone. Again, it's through the National Library of Medicine, which our library is a member of. We're the Mountain West division of that. So I created this long string you can see from that last one. So the teenager parent kind of string. Now I'm interested in kind of the nursing side, interested in school side, and then the high school graduation side. Now, no, because this is a fairly complex search, I might not get anything to begin with, but let's go ahead and see. Okay, it looks like I am given at least one article. So one article popped up here in this area. You can see by reading the title, it might not be exactly what I'm interested in. So this is where I would recommend going back to this and saying, okay, what are things that might be maybe too specific that I might be okay with not including in a first go? For me, it would be this in-school meetings. That was the comparison, and maybe that can be captured elsewhere. So let's take out that and see what we get. Okay, you can see by making one small change, I'm now given over 8,000 results instead of the one. So this is going to be a lot more helpful to me. You can see here that this is where I'd probably use filters. I can filter it by date. So maybe I'm just interested in like the last maybe 5 years or so. Okay, so that's giving me now around 4,000. You can see maybe I'm just interested in like review articles or systematic review articles. Those mean that it's an article that's combined several articles and reviewed those for you. That can be really helpful, especially when you're first starting out on a research topic. You can see what's been published in that area before. So let's just say we're interested in reviews for now. Yeah, and then there are additional filters as well. Maybe I am for this one, I might, because only female pregnancy, I might be interested in that. Language, maybe you're interested in another language. This would be age, which we're interested in the adolescent age. So let's go ahead and show those and select those. So I'm interested in female, and I'm interested in, let's see, okay, so now I've narrowed that 8,000 into about 4 articles now based on this. So now I can kind of go through these and see, okay, do these tend to be interesting to me? Are these what I'm looking at? This one looks to be a little closer. I'm going to remove the adolescent one because I saw that, yeah, there's 48 here. These might also be helpful to me. So this is where you'd kind of just look through these to start saying, what are some of these articles that would be more related to my topic? And some of them aren't going to be exact like this one. Maybe you're not exactly interested in this living with HIV piece, but there is a lot to it that you are interested in, like improving retention and that postnatal care in adolescence. And so although it's going to give you a little more than you want, this would and could be a good article. So something to consider is, okay, let's say I am interested in this. These are the authors. I can see their affiliations here. I can read the abstract. I can, this is a nice piece they've added where you can look at similar articles based on those based on those keywords we've looked at, you can see who cited this. So this article was published in 2021, so it's fairly recent, but you can see since 2021, so a lot of these are 2023, who has cited this article. And then you can also see which references are within this article and look at them within PubMed. So that's really nice. And then you can also see these publication types. Again, this is a review. We talked about how that could be handy when you're first starting out. And then these terms, which they call mesh terms or medical subject heading terms. These can be really helpful when you're trying to narrow in on a topic, because these are kind of terms that are assigned to this article from PubMed. So it's kind of like a hashtag on social media, how when you're interested in seeing all dogs on Instagram, we're gonna look at hashtag dogs, right? So this is kind of the hashtag version of what social media is, but for articles. You can tag any article that has pregnancy, for instance, pregnant women, postnatal care, adolescents. I can then add these to my search. I can just search these alone and add them later. So let's say I like interested in adolescents, for instance. If I am searching by mesh, I usually take the keywords out and just kind of start over with those. So let's say I'm adolescents, I'm interested in pregnancy and prenatal or young adult. Let's just see these two. Yeah, so this is giving me 5,000 plus results. Again, this is a broader topic that I could narrow down if I'm looking at like graduation. So now I'm given 39 results. I know, like, looking at this topic specifically, knowing that PubMed is just one area and it's focusing on health sciences, there might be a lot discussed in the literature outside of health sciences in this area, like maybe their behavioral social, maybe the economic aspect of this, the kind of the humanities, ethical side. And so those are all things to consider. Maybe you're looking at other databases outside of PubMed. So our library database is available to anyone. It's EHSL for short, or the Eccles Health Sciences Library. We have this really nice kind of find articles area where outside of PubMed, you can look at other articles in the area of health sciences based on where you're located. There might also be others that you're interested in. This research guides tends to be a nice area to go where you can find maybe your area. So if you're interested in global health or health and kinesiology, we have medicine, nursing. We've also put those databases that are most in line with those areas here. And no, again, you can always reach out to a librarian as well. You can ask us a question. We have a chat feature, which is really nice. You also have our email, or you can call our front office and we can connect you with someone. Okay, before we leave time for questions, I just want to discuss a few other tools that might be helpful for you. Okay, so one tool is when you're going to different sites, you might mention, or you might notice there is kind of how many people have viewed it, cited it, saved it, shared it. That can be really helpful when you're starting to think of your impact as a researcher, kind of outside of those citations. How many people are actually seeing this and who's sharing it? So that's something to consider. And there are these metrics now, like PlumX is one of them. Again, these are more of those alternative metrics in which you're seeing the clicks, who's clicking on this article. You can even see on social media who's tweeting it out or who's sharing it. So those can be helpful when you're starting to see whom your research is reaching. You can even see by like date when it's coming out. There are maps now where you can see by map who is reaching this article. This is another article, but they're using Altmetric instead of Plumex, which is kind of similar. Yeah, here's that that map now. I can see mostly it's being used in the United States, but there's also some people from the UK as well as some other countries, mostly located around Europe, that are looking at this topic. I can see what news outlets have picked it up, some blogs, which people have liked it in terms of tweet, Facebook, and then you can see who's reading it on a citation manager called Mendeley. Yeah, so Altmetric is a nice tool to use as well. And then I also want to mention this ResearchGate. This is like the LinkedIn for researchers. So this is a good tool to use if you're wanting to connect with other researchers. If you're wanting to get out your articles, you can see here, this is my colleague Nancy Lombardo from our library. You can see, you can mention what skills you have, some demographic information, and then your kind of research, your stats. And then you can connect with others that way. Yeah, and this is an example of some of Nancy's stats and citations, recommendations, full text reads, etc. Another great tool to finding a good journal is this Jane, which is also free to anyone, for anyone to use. It's Journal Author Name Estimator. And basically you can type in or copy paste your abstract into this, and it'll find, based on those keywords, what are some big influenced articles that you could potentially look into. And again, it might be worth looking into the impact factor as well of these. For funding, if you're not associated with a college or university, you might consider like grants.gov, which is a free one. This is something that people at the U tend to use, which is Pivot. It's called Pivot RP. It's just a way in which you can be connected to different funding sources. So if you are in that area, I would recommend looking at grants.gov. If you do have a tool at your institution, and use that. Also talk to those people within your field and see what they're working on, in ways you might be able to either be included on their funding, or maybe they can provide some information and tips for you to get funding. That can definitely be something, especially as you're starting out. You want some of those seed grants that can help, and a lot of times your mentors or people within your field might have some good areas in which to find those. Again, I'm just one of several people here. This is our team, and we've actually included some more since then. So we have a guide where I've kind of gone over some of the scholarly work. Here's more information on bibliometrics and impact factor. If you're associated with the university, there's a series called the Research and Education series, and they have some about getting published as well as searching. Yeah, here's my information, b.patterson@utah.edu, and my phone number as well. Okay, so I'm going to stop sharing. I see some chats have come in. Let's see, looks like Tatiana had a question. Are these services available to students outside of the U? So for the most part, most of what I went through today is available to people outside of the university. PubMed, for instance, a lot of those databases initially you can get into. It's once you're trying to access the full text that you usually have to rely on your institution to provide it. But oftentimes you can search in those databases without access to like the university, for instance. If you are with another university, a lot of these that I mentioned are available at universities throughout Utah. We actually created a pact through the Academic Health, oh no, it's the Academy of Academic Libraries throughout Utah that went in on purchasing some of these. And so that can be helpful.
Okay. Thank you so much, Brandon. I also wanted to acknowledge in our audience that we have our board members, Martell Teasley, hello, and Jennifer Lloyd. Thank you so much for joining us. If I'm missing someone, just hit me over the head. I need to eat. So any other questions? Thank you so much. I'm so glad that this is available to everyone. So of all of these things and joining things, which ones do you think should be our top 3?
I would say certainly the PICO, finding ways in which to use that, acronym in order to find searches or keywords that you can search. Then utilizing something like PubMed to then go into, I think specifically within PubMed, those mesh terms, which I mentioned towards the end of my searching, those can be really handy. So mesh terms within PubMed, PICO, and then the third one's just ask a librarian. We're really helpful people. Even if you're not at Utah, if you're at another institution or hospital, a lot of hospitals will have librarians. A lot of people didn't know that, but I know like Primary Children's here at the U has its own librarian. The University Health System has a clinical librarian, and there's librarians across those hospitals. So ask your librarian. They can be very helpful.
Awesome. Also, I need to acknowledge Miss Mindy Bateman. She's also our board member. So sorry, Mindy. Thank you for joining us. So and this ORCID thing too, they keep pushing us to do that.
Yeah. So ORCID is something that's gained a lot of traction recently. I think because similar to like a social security number, it's just a number attached where you can then find people really easy. You don't have an article that gets lost in the interwebs. You can be connected more closely to your research and the research you put out. So definitely it's good to start one, even if you haven't published yet, just so you can start to have that associated with your work. Even if you're there are conferences now that when you're uploading like a poster or a paper, you can link your ORCID onto that. So it's become kind of your scholarly identification.
Exactly. Hey, Tatiana, you have a question?
Yes, I love Altmetrics, but could you share with the audience some of the uses for the Altmetrics? Also, let's see, what that's my question. I forgot my other question.
Yeah, so these alternative measurements for scholarly impact, like Altmetrics or Clemex, is that you can see outside of just citations and your H-index what you're contributing to. So I've seen a lot of people use it in terms of, there's a lot in the library world about fake news, false information. How do we get people to know what information is accurate and which is false? And so Altmetrics kind of looks at ways in which that's being talked about a lot on social media. A lot of people are linking to this article I wrote on it. Maybe it's not a scholarly necessarily thing that people are looking at, but it's definitely reaching that audience I want it to reach. So it's reaching maybe more of a lay audience or an audience of patients that you're looking at, as opposed to just those other researchers that are citing it.
Thank you, Brandon. I remember my second question. It was regarding electronic or digital posters, research posters.
Mhm.
Do you advise our students use them for the research to share? Tell us more about that. Thank you.
Yeah, that's a great question, Tatiana. Thank you. So, what I talked about today is research that, like PubMed, is the database for peer-reviewed journals, and so all these articles have gone through a peer review process. There is a lot of research being disseminated amongst conferences, and that's happening through digital posters or presentations that are recorded, or maybe you're getting a PowerPoint presentation. That's still something you can cite. You can cite posters, you can cite presentations. Know that that's considered what's in the library world as gray literature, or literature that hasn't been published fully. So oftentimes it is worth saying in, let's say you are writing a paper, that this is still preliminary results, but based on a poster from 2023 in this so-and-so conference, they found that blah, 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 blah. And then you can talk about those things. But knowing that if it hasn't been published yet, it's just, you have to explain it a little bit more. But yeah, certainly you can cite digital posters, and please, if you're interested in getting out there, sharing your research, posters are a great way to do that yourself.
And do you recommend they download an electronic copy of their posters to bring to conferences, just to share the actual poster, not as a publication, but just do you recommend that as an easy way to spread the word about your research?
That's a great idea. Yeah. So even if it is a paper version, I like even taking a photograph of that and then sharing it again, because you can see what altmetrics or other services can do. You can share your poster via maybe the Twitter platform, or on your Facebook page, or any of these other areas. Even with, if you're deciding to open a ResearchGate, which is that LinkedIn for researchers, you can share those posters there, and then folks can start to talk about it. But yeah, definitely, if you can, digitize those posters and get the information out beyond that conference if you're able to.
Oh, you have a comment in the chat. Did you see?
Yeah. As a DMP student, I have always struggled or spent time searching an article in PubMed or Google Scholar for class. Do you think that the use of AI in the future could be a game changer in finding right articles for PubMed or Google Scholar within a few seconds? That's a great question, and we've gotten a lot of interest in ChatGPT and AI, ways that these tools can help researchers find information quicker. Regardless, it often goes back to that prompt or those search keywords that you're initially finding. So it goes back to that PICO. A computer's never going to be able to find what you want if you're not able to, synthesize or get that information to it. And so, yeah, I would spend some more time, if we are considering AI. Really, it goes back to the researcher really succinctly finding the information that they want, so that they can then prompt the AI to find those articles that they're interested in. So it's not going to be a perfect system, but hopefully, yeah, it allows maybe users to focus less on like the nitty gritty of the Boolean operators and the mesh terms and some of that stuff, and more on developing their question and getting that prompt for the AI tool. But really good question. Yeah, we'll see more in that area, I'm sure, in the next few years.
Yes. Thank you so much, Brandon. I want to take this opportunity before everybody starts dropping off. Prudvi, if you can announce our mini grants, please, one very succinctly. You're awesome, Brandon, and we want you back with a part 2 of the research tools, okay?
And I did it very fast today. I know there was a lot to cover, and I kind of went back and forth a little bit, but hopefully you got a few takeaways, and know that the library and the librarian is there for additional support. So reach out to us.
Thank you. Thank you. Ruthie?
So currently we have a second round of applications for our 2023 mini grants. And as some of you know, it has to be focused on any of these 3 topics, which is cultural proficiency, interprofessionalism, health workforce retention, health and justice, ethics in public health. So at least 3 out of these 5. And right now we have extended the deadline till 30th of this month for the pre-proposals. And it's going to be a 1-year funding of about 10,000. And yeah, and the link I just posted, you can find all the requirements for the pre-proposals and the full proposals. It's a wonderful opportunity, and it's only for the AHEC scholars.
Please spread the word, because it sounds like 10,000 is nothing, and I want to just tell you about one of our students used it for her dissertation, and she's about to graduate. She's gonna graduate very soon, and very happy because she got that that money. Often we're left with mom and dad and whoever else we can ask for support, right? And sometimes there's no mom and dad, and we need to get third-party money. So it's a good start, for your research. For AHEC scholars, of course. And speaking of AHEC scholars, Sydney or Tatiana, if you want to direct people to how to join the AHEC scholars.
Thank you, Dr. Lopez. Yes, I'm going to put the link in here, but I also want to remind the scholars present to fill a reflection form to get credit, elective credit for attending today's session. And I'll put the link to register as an AHEC scholar to share with your peers, as we are heavily into recruitment season and we have a few spots left. Thank you.
Well, I think we packed everything in. Any final thoughts anyone has, or final questions?
I was glad to see those grants, because again, that can open up the possibilities for other grants too. If you're able to do a pilot study and show you the effectiveness of that could definitely open up to more. So
indeed, Prudby has put a lot of thought into the design of the grant application, so it prepares our students for future grants. I encourage you, I see many of you that were interested. I encourage you to apply. It's going to be a great experience. I'm not saying easy, but super great for growth and learning, and prepare you for the big $1 million grants.
And we see big futures for everyone. So with that, I'm going to leave you. Thank you so much for attending the conference. Thank you to the AHEC staff for putting it together, Prudby. Thank you so much, Tatiana and Maisa. And so we'll see you next time, which would be next month. And that's it for us. Have a great day.
bye. Have a good fall.
Bye.